Hello everyone to my YouTube channel Scottish XXY Guy. If you are new to this channel, my name is David. I was born with Klinefelter syndrome 47XXY. I talk through a text-to-speech app on my laptop and or on my phone. This video is about the side effects of being on testosterone treatment. As there is side effects, what does affect me? About 10 years ago now, I had blood tests done and my red blood cell count was going up and stayed high for a real long time, and the blood specialist got involved and they sent me for more blood tests to be done to find out why I had so high red blood cells count, and they did found out I have got a medical condition called secondary polycythemia, where my body makes far too many red blood cells because of the testosterone treatment. It can cause me to get blood clots in my legs and lungs, or something more worse than that, as in having a heart attack or a stroke. As the blood count goes up, the blood can't move well throughout my body as it comes really thick, and it can cause serious problems, and I am high risk of having a full-on heart attack now. As my blood count is in the danger zone of coming a major issue with my health, as when I am out walking, I get so out of breath I almost turn blue at times due to the oxygen in my blood can't travel around my body well, as it is too thick to pass through my heart and veins in my body. And in the past I had venesection done. There they remove about 600 milliliters of blood from my body. Is same process of giving blood, but my blood couldn't be used on anyone else's due to the medication I am on and due to the testosterone treatment I am on too. As in Scotland, if you are on testosterone treatment, no one can give blood due to the law, as testosterone can be passed on to the other person who get the blood from the blood bank. Therefore, the blood I have taken off is just sent to be burned. But now my specialist have lowered the testosterone dose I was on from every 2 weeks to every 3 weeks at 250 milligrams at 1 milliliter injections. I do self-inject my own testosterone, have been doing it since February 2018, as me and my later husband was planning on a once-in-lifetime travel to Iceland for 12 weeks after we was married in Caithness in Scotland. Why I asked my specialist to let myself self-inject, as in the book almost every person who is on testosterone treatment, the local nurse at the GP surgery do the injection for the person. It's not like the US, they're the person who is allowed to self-injection their self. I had to wait until I was given permission from the NHS and by the GP surgery manager to let myself do it, and it has changed way I live my life now. As before, I used to go to the nurse for mind and used to be a pain trying to book an appointment with one to do it, as where I live on Caithness in Scotland. Now the nurse appointments are difficult to make one due to the waiting times are really long, as have to book in advance, as in 4 to 6 weeks in advance just to see a GP or a nurse. Now, like the normal routine blood tests I get done every 6 months for Klinefelter syndrome and for the other medical conditions I do have, is difficult to make an appointment. Like the endocrinology specialist I have appointment with once a year, as they no longer do face-to-face appointments with myself, as they do video call or a voice call with myself. But I find it a bit difficult for myself with having verbal dyspraxia and Klinefelter syndrome. Both can make a speech impediment, as people can find myself difficult to understand what I am saying. Why I use a text-to-speech app on my mobile phone and a Relay UK service to make phone calls with, as when I go to the hospital or see a GP, I write everything down as a note first, so I just need to show the doctor, as I find it be more easy for myself, as the secondary polycythemia has now caused myself to have a thicker heart muscle, what have caused my blood pressure to go up, but due to myself Being highly allergic to beta blockers, they can't give me anything to lower the blood pressure. Only way they can control the blood pressure is to remove some blood to stop it being so thick, because when they remove the blood it does lower my blood pressure by 50%, as most of the time my blood pressure is about 140/90, which is really high, as normal blood pressure meant to be about 60/90, but due to the heart muscle is being thicker and having the secondary polycythemia, what has caused a lot of unwanted problems with my heart now, and I am under the heart specialist now to find a way toward in my life so I can get the treatment to live a normal lifestyle. As I do have episode of cheek pain which is caused by the secondary polycythemia, as the blood is not being able to pass through my heart well, and I have now had 3 different times I had a blood clot in my leg and lung, which passed through heart to my lungs due to the blood being too thick. The last time it happened was in May this year 2023. I was cough up blood clots, and due to that and having the worst cheek pain I never had, I had to call for an ambulance for myself using the Relay UK service and was rushed into the local hospital. There they done scans and blood tests to find out if it was a blood clot or not, but it was confirmed I had a blood clot and put on treatment for it. I am hoping this year the specialist to find a right treatment plan for myself so I can start to have a more better lifestyle, as every so often I do have bad attacks like episode of cheek pains and blackout because of the blood being too thick in my body. Thank you for watching my video. Hope to see you on the next one.